The Global Fund is an international financing and partnership organization that aims to end the epidemics of HIV and AIDS, tuberculosis, and malaria. Nigeria is both a donor and an implementer of Global Fund support programs. Hello and welcome to this week's episode of The Last Mile with Naca. I'm Adesuwa Osui. Naca manages 3 grants from the Global Fund as a principal recipient and partners with relevant institutions and organizations within the country to implement the grants. More on this in just a moment. Don't go away.
Established in 2002, the Global Fund is an innovative financing mechanism that raises funds from developed countries and private entities for programs that reduce the impact of HIV and AIDS, tuberculosis and malaria in low and middle income countries such as Nigeria.
The major financing country for the Global Fund is the United States, followed by other countries in the G8 such as France, United Kingdom, Japan, and others. While among the privates, we have the Bill and Melinda Gates. They are the big financiers. So the Global Fund has been partnering with Nigeria as far back as 2003. That is just a year after its creation. And Nigeria coincidentally happens to be playing 2 roles. Even though Nigeria is considered as a low-resource country, but Nigeria at the same time is also financing the Global Fund, meaning that they put some shares there, but then at the same time they also get funding from the Global Fund. So, so far since 2003 till date, Nigeria has benefited a lot with about $4.4 billion US.
In-country operation of the Global Fund, even though it has no presence in recipient countries, is through the Country Coordinating Mechanism, CCM, a national committee made up of representatives of all sectors that submit funding applications to the Global Fund and oversees grants on behalf of the country. Principal recipients: designated in-country organizations chosen by the CCM to receive funding allocations from the Global Fund Secretariat, implement programs and distribute funds to sub-recipients according to the grant agreement, and local fund agents to ensure financial accountability.
Under Naca, we have like 3 grants through the Global Fund support. We have the HIV grant, we have the Health System Strengthening Grant, which we call the Resilient and Sustainable System for Health, and then we have of recent the COVID-19 grant, which we call the COVID-19 Response Mechanism. So these are 3 grants that are managed by Naca. So Naca, as principal recipient for the Global Fund, also partners with other organizations and institutions within the country to implement the grant. So those other ones that Naca is partnering with, we call them sub-recipients. And for example, for the HIV grant, the sub-recipient for the HIV grant for Naca is the HIV program in the Federal Ministry of Health. While for the Health System Strengthening Grant, we have 4 sub-recipients that are partnering with Naca. And we have the NCDC, which is tasked with strengthening the laboratory systems. And then we have the National Primary Healthcare and Development Agency, which is tasked with strengthening of the community system component of the grant and integrated service delivery and quality improvement. And then we have the National Program on Health Product and Supply Chain, which is MPSCMP, which is tasked with strengthening the procurement and supply chain system in collaboration with NAFDAC. We also partner with the Department of Health Planning, Research and Statistics of the Federal Ministry of Health, which are tasked with strengthening the health management information systems. For the COVID-19 response mechanism, which also is being managed by Naca, All the ones I've mentioned, most of the ones I've mentioned, for instance, above, are also working with Naca to implement the grants. And we have other ones like the network of the disease programs, like the NEP1, Aquamin for malaria, and several others.
The Global Fund adopts a model that disburses funding in 3-year cycles known as replenishments to governments and in-country stakeholders based solely on proposals and implementation plans designed by the countries themselves.
Usually the grants run 3 years. So like the current grants I mentioned to you are running from 2021 to 2023. So around that 2023, when this one elapses, then another grant will come. So there are some grants that are constant, like the HIV grant, for instance, and others. But for the COVID-19 response mechanism, it's like an emergency intervention that's due to the COVID pandemic. So Global Fund usually looks around and see if there are any emergencies that need to be addressed for these 3 diseases to continue to, for us to continue to support these 3 diseases. Then they will come quickly and intervene. So at this time, those grants that have been are always been supported, we hope they will continue to be supported. And everything is subject to availability of fund. Remember that the Global Fund source finance from other countries and from other private entities. So it's only when they source for those resources, and then they will now inform countries that, okay, resources are available, please bring your submissions and bring forward for us. So they will look at it. If we approve, then they will make the resources available for us.
Naca's innovative strategies at the peak of the COVID-19 pandemic helped position Nigeria as the most resilient country under the US President's emergency plan for AIDS relief.
There was concern when the outbreak of COVID happens that how HIV is going to be managed. How do we do case finding with all the restrictions, lockdowns, and many other things? So Naca really did very well because other countries in the world, most of the countries doing similar programs in the world, they were a declining trend. Nigeria, under the leadership of the Naca, was able to come with innovations, think outside the box, come up with innovations to see how we can work and continue to identify cases, HIV cases, amidst the COVID pandemic. One thing that really helped during the outbreak is we took the services into the communities, including treatment, viral load tests, everything. We took it into the communities and then carry out targeted HIV testing. When I say targeted, I mean using data that guided us where to go and test. Some of the strategies that were deployed during the COVID pandemic in the communities are really great strategies that we, even now, even when the COVID get eradicated or controlled, we will still continue to use them because those strategies have been proven to be very effective and efficient way of doing things.
In countries where the Global Fund invests, AIDS-related deaths have dropped by 68% since the peak of the epidemic in 2004. Also, of the 27.5 million people on antiretroviral therapy today, 21.9 million are in the countries where the Global Fund invests.
With the support from the Global Fund right now, we have about, for HIV, I can tell, we have like 1.6 million people receiving treatment for HIV through other partners and of course the Global Fund. This is out of 1.8 million people living with the disease in the country. For the health system, which I want to also add to that is, at the end of this grant, we should be able to have a 12 world-class medical warehouses around the country. Each geopolitical zone in Nigeria will have 2 world-class medical warehouses. These are going to be solid structures that are going to be world-class standard to help us store our health products and drugs. You know, you can't store drugs anywhere. You need some requirements in terms of temperatures, humidities, and things like that. So that's what we are going to do. Additionally, we have selected 12 laboratories that we are going to also improve on them, renovate them, furnish them, equip them with all that is needed for us to be able to respond to disease of public health importance.
Naca plays a critical role in the Global Fund grant cycle in Nigeria, providing the needed national policies and framework.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
The update segment brings you highlight of Naca's activities across the country and elsewhere. Keep watching.
The National Agency for the Control of AIDS, Naca, recently organized a press conference in Abuja as part of activities to commemorate the 2021 World AIDS Day. In his opening remark, the Director General, Naca, Dr. Aliyu Gambo, thanked stakeholders on the progress made in the fight against HIV and AIDS. Speaking further, Dr. Gambo explained that despite the impact of COVID-19 pandemic globally, the HIV program in Nigeria saw an increase in people placed on treatment.
The global theme for this year's commemoration is End Inequality, End AIDS, End Pandemics. However, the national theme is End Inequalities, End AIDS through sustainable HIV financing in Nigeria. In Nigeria, over the last few years, we have recorded significant progress in our fight against HIV. A recalibration of HIV epidemic shows a significant decline in HIV prevalence from 5.8 in 2001 to 1.3 in 2018. Presently, it is estimated that 1.8 million people live with HIV in Nigeria, of which 90% are aware of their HIV status, 96% are on treatment, and 84% are virally suppressed. Despite the negative impact from lockdown during the COVID-19 pandemic across the world, the HIV program in Nigeria proved resilient with an increased number of people that were placed on treatment.
The Naca DG also called for stronger synergy between government and non-government actors to champion the cause of ensuring epidemic control and sustainability.
The Nigerian national response is at the last mile of its epidemic control. Therefore, pushing for the last mile is crucial, and also pushing for sustainability is extra crucial. In the last mile of HIV response, the public and private sectors, the communities, all stakeholders in the national response have roles to play to ensure epidemic control and sustainability. Ensuring state ownership and ending AIDS remain on the political agenda, overcome all barriers that prevent access to services, creating an enabling environment that promote equal access, safeguarding the rights of people living with HIV/AIDS, and hold decision makers and implementers accountable. Holding implementers and decision makers accountable are all on the table.
Goodwill messages were delivered by representatives of the Federal Ministry of Health, United Nations, US government, civil society organizations, implementing partners, and other relevant stakeholders. World AIDS Day is marked on December 1 every year since 1988. It is to raise awareness on the AIDS pandemic caused by the spread of HIV infection and mourn those who have died of the disease. This HIV self-test kit has been certified safe and effective by the WHO, Federal Ministry of Health and Naca. For more inquiries, call the Naca Information Center free of charge on 6222. Do not eat, drink or use mouth cleaning products 30 minutes before the test. Find somewhere private with good light and a flat surface. The kit includes instruction leaflets that should be read carefully, a test stand and a sealed package containing a test device, developer tube and preservative used for storage only. This is not needed for the test. Open the test tube and place it in the test stand. Grab the test device by the handle. Do not touch the flat pad. Apply moderate pressure while swabbing the flat pad once along your upper gum and once along the lower gum. Immediately put the test device in the developer tube. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Test is positive if both control and test lines appear, in which case you should contact Naca Information Center as soon as possible for advice on the next step. Test is negative if only control line appears. Test is invalid if there are no lines or only test line appear or the white result background becomes red and should be repeated. Properly dispose all contents in the normal trash. Support Naca and the fight against HIV. Know your HIV status today. The National Agency for the Control of AIDS, Naca, in collaboration with Johns Hopkins Program for International Education in Gynecology and Obstetrics, recently held a 4-day training for health journalists in Lagos State. The training, tagged National HIV Media Advocacy, Social and Behavior Change Communication Skills Building Workshop, was informed by the need to meaningfully engage with the media as a critical partner in fighting HIV and AIDS to finish in the country. A national HIV media advocacy platform comprises media representatives from different states of the country and head of public relations unit and zonal coordinators of Naca, among others, was also inaugurated to increase awareness on HIV and shape the way the media reports it. Launching the HIV media advocacy platform on behalf of the Director General, Dr. Gambo Aliyu, the Deputy Director, Public Relations and Protocol, Toyin Aderibigbe, urged the journalists to be HIV awareness ambassadors wherever they find themselves.
I inaugurate the National HIV Media Advocacy Platform, and we hope that it will change the way we report, it will change the way we do our reporting, and it will create more awareness in the HIV response.
Chief of Party, Johns Hopkins Program for International Education in Gynecology, Emmanuel Atuma, stated that the current National HIV Strategic Framework recognizes that strengthening the use of social media platforms and traditional media to communicate a health promotion agenda is vitally important.
Japaigo Rice is particularly happy to be in this vanguard in support of Naca, to move this initiative of getting the media actively involved and responsible in social mobilization and becoming that change factor for the country, that change platform that you can mobilize change, especially for us. We have a unique interest for adolescent girls and young women. It's a unique interest for us because they are predisposed and they are most at risk for the infection. And we want to be able to ensure that we reach them through our communications, through our human angle stories, things that will attract them and be able to bring them into one, identifying their status and taking steps to mitigating risks to infections, as well as driving and closing and preventing new infections.
Some participants commended the agency for the training and HIV media advocacy platform, stating that it will impact HIV reporting for the better.
For us journalists, we normally, think we know it all until you come to places like this and begin to understand that there are certain things you don't know. And for the work that we do, to be able to effectively inform people, we need to be informed. So for me, my key takeaway is this. Sincerely, before now, I didn't know that there was something like PrEP. But now that I know about PrEP, I'm going to be doing a lot of research about it. I'm going to be helping them disseminate that information. For me, it's my key takeaway.
This program has been very, very impactful because in the past, I've been seeing, HIV and AIDS from another different angle. The way we write stories, we just write them, we just feel I have a story to write about somebody. But today with this, I've come to understand that I have to write the stories with empathy. I have to put them into consideration that they are human beings. They could be somebody's sister, they could be somebody's brother. So it has really changed my perspective towards writing stories about HIV and AIDS.
HIV, by its nature, it's a human matter. And so when you are going to talk to the person, to the human person, you need to speak to the person's heart and to the person's brains, all right? So you need stories that are emotional in nature, and that's what's missing. A lot of Nigerians know about one or two things about HIV by now, but what's missing is that compelling feature story that will move that person from the point of awareness to the point of knowledge, where he or she is able to, on her own or his own, be able to take a useful decision to improve his or her well-being using factual reporting by the media.
Highlight of the event was the presentation of certificates to participants.
We noticed that there's a fatigue of HIV news in the media, and we have to find a creative way of engaging the media, a meaningful way of engaging them, so that they can bring stories on HIV, because HIV is still a threat in Nigeria, and we have new innovative things happening in the HIV response, like the self-testing, like the PrEP. So we want the media to know so that they can be our partners in progress in the fight against HIV in Nigeria.
Naca's vision in the National HIV Strategic Framework is for Nigeria to be a nation of people with functional knowledge of HIV and AIDS. The media involvement and engagement is key to ensure synergy with this vision.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor, or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with Naca, I am Adesuwa Osui. Goodbye.